Hi, welcome to Wellness Woodbridge. I'm your host, Ann Mazza of Vito Mazza Salon and Spa, and today we're here at the Woodbridge Medical Pavilion, which is a beautiful facility that we just want to make our wellness viewers at home aware of what Woodbridge has to offer now by way of a beautiful urgent care, obstetrics, gynecology, also sports medicine, physical therapy, and I'm probably not even mentioning a few other things that this facility has to offer. So I'm here with Dr. Bilar again today, and he is a fantastic doctor right here at this facility. He specializes in sports medicine, and we're going to talk a little bit about wellness issues and how sports medicine can fit that into your lifestyle. Hi, Dr. Bilar. How are you?
Good. How are you?
Very well, thank you.
Thank you for having me.
So this is gorgeous. It's exciting to be here where you practice here in Woodbridge. We've never been here before. We have talked to you before, but we've never been to this location. So it's great to be able to show that to our wellness viewers at home.
Yeah, no, it's a great facility, and you're right. We did speak a lot about it last time, and it's great. Thank you for coming out here so we can show you a little bit about our place here. It's a great location as part of Raritan Bay and Human Emotion Institute. It really fits our model. We have a vast amount of services here, including OB. We have physical therapy, which goes along with what I do here. And one of the primary reasons why I chose this location, because I work closely with physical therapists in Raritan Bay, and it was just an ideal location and a great opportunity to treat the community of Woodbridge.
Wonderful. I know that Woodbridge really doesn't have a hospital per se, but this is a great location where a lot of your needs can be met. With regards to the sports medicine, how do you treat patients and how do you get your patients that you know would fit into the services that you offer? Well,
first of all, to see a sports medicine specialist, you don't necessarily have to be an athlete or have a sport injury. The concept of sports medicine, or the specialty of sports medicine, not only focuses on the endurance athlete or the traditional athlete, but it focuses on any individual that wants to get healthy and suffers an injury or wants to get back to be more active and more functional. So I consider myself a non-surgical orthopedist. I treat all aspects of orthopedic medicine, all aches and pains. And my primary focus is to help guide patients or help diagnose them and give them a good plan to get or return back to their function and with less discomfort.
So we call this an integrative medicine facility. Basically, like, that's a little bit more on the holistic side, not surgical like you were just saying, and to be able to incorporate the physical therapy and have that right here has to be a huge benefit to your patient.
It is a huge benefit. A lot of times when patients come in for an injury or have a particular discomfort, what I stress to them, it's easy for me to say, well, to diagnose them, but it's more important for them to understand and have a good plan to leaving the office so that they can get back to where they want to be. Now, some patients are motivated, they exercise, they're familiar with specific exercises for specific muscle groups. Other patients need a little help, in terms of guide and direction, and that's where physical therapy really comes into factor. The way I explain physical therapy to patients is that it's a building block. It's a tool that we use initially to get patients to a comfortable level where they know that they will be doing the exercises correctly and have assistance if they need it, and then be provided a good home exercise program so they can therefore prevent further injury, or not only treat their injury but also prevent their injury and change their lifestyles.
I think one of the things I'm learning, from just focusing on wellness issues is a body in motion is a healthy body. So I think the more we move, the more we are healthy, the more our body is healthy. I think that's what we were designed to do. So what do you think is a great help with some of those things, to get people moving who maybe really aren't in the habit of it?
Well, number one, it's the understanding, like you said, that the old school ways of for example, back injuries is to stay in bed for 2 weeks. Nowadays, what we're learning based on research and based on just traditional science is that, as you mentioned, to be more active is to be healthier. Not only in being healthier stems from not only exercising, but also from diet in proper choices, right, and throughout life, from sleep patterns and in the way you work and posture, and all of these factors fit in together in terms of making one healthy. One interesting thing that I like, and I actually use myself, is having a motivator, right? And one of these motivators that are out there now are these fitness bands. And I think they're a great tool primarily for monitoring how active one is during the day. I have plenty of patients that come in and they say, well, I don't exercise, but I walk a lot, or I'm active, I'm never sitting down. Well, this is a way to actually quantify that by having a pedometer and measuring how many steps. So
it's kind of like a reality check.
Sort of like a reality check.
Let's see how active you really are.
Exactly. And numbers don't lie, right? So numbers don't lie. But the important thing about Fitbits is that someone who, being that it is a new year, and there are a lot of folks out there that may have New Year's resolutions in terms of becoming more, or wanting to become more active. It is something you can buy on Amazon or through any of these stores. However, it's something you don't just want to jump into. There are different Fitbits out there. I'm not here to promote any particular one. But there's those that are traditional pedometers that just measure the steps, and there are those that actually measure your heart rate. In terms of heart rate, before exercising and getting into any form of vigorous cardiovascular exercise, especially if you have some medical history of diabetes or hypertension or family history of cardiac history, or just have never really exercised before, you definitely want to visit your primary care doctor and make sure that your heart and blood pressure and your body's actually able to fit or withstand some of the stresses that you plan on putting your body to test with. So I think that's very important.
Would that be a time that someone could come and just get a physiological exam from a doctor like yourself?
Yeah, I mean, as an internist, I am schooled in terms of general health. Okay, my practice focuses more on the orthopedic exam. So I would actually defer the cardiology examination to a cardiologist, or just start with your primary care doctor, who can do a lot of these testings for measuring blood pressure, doing routine checks for cholesterol, just categorizing your risk, and then I can help them based on their risk factors to put together an exercise program that gradually improves or increases their heart rate and their activity level, so they're not putting their body at risk.
Excellent. Well, it sounds like a lot of information. I am so excited to take a tour of the facility now and see what else you have to offer. And I think that if anybody wants to get moving, they should definitely come over here and take a look at what you have to offer here. Dr. Bellari, you're really great at what you do, and we're happy to have you right here in Woodbridge.
Thank you very much for having me. Appreciate it. And I look forward to giving you the tour.
Great. We'll be right back. So here we are in the beautiful intake area of this Woodbridge Medical Pavilion. Tell us about what happens when you walk in the door here.
So patients are going to walk through the door, and they're going to be greeted by one of the front desk staff here at the pavilion. For example, my staff would be here on the corner, so they check in, they get their paperwork, and then they'd sit down in the waiting area that we have here.
Great. So we'll see the rest?
Absolutely. Let's go. So this is our exam room. Patients are brought back here by the medical assistant, and this is where we conduct our orthopedic exam and give them a plan or a diagnosis, and give them a plan to get better and back to their function.
Beautiful.
Yeah, it's comfortable. It's well lit. It's not crowded, so there are good spaces here. And if patients want to bring their family members, there's enough room in this facility that allows that.
That's great. So now you're going to show us the X-ray facility. That's great that you have it right here on location.
So this works out to be very convenient for the patients to have X-ray here on site.
Definitely a benefit to have the x-ray equipment here. If you have to send a patient out, it's got to be a lot more time consuming than doing it right here.
Right, so for patients that come in for urgent care, they're coming in for an acute injury. So it's sort of like a mini ER, and having x-ray here definitely makes it a lot easier and more convenient for the patient. So this is a digital x-ray machines, and everything is digitized, and the x-rays are not printed on film, but they come up on the computer. And for patients that need to follow up with me or an orthopedist or anyone else, they're able to request a copy of their x-ray and get it on CD, which makes it more convenient for them.
So how quickly do they get read, the x-rays?
I think the urgent care, what they do is they actually have them read within 24 hours. So the x-rays are read by the treating physician, and then they're sent out for official report, and they get it back within a very short period of time.
That's excellent. Yeah. Very, very good.
It's convenient. Works out well.
So Dr. Ballar, this is your main physical therapy area?
Right. So as you know, after patients see me, if they're acute, what I do is I come over here, I speak to the physical therapist. We try and get them into care right away. So this is not the treatment area, this is their workout area. So what you're seeing here, you have the treadmill, you have the elliptical machine, you have the cycle. This is a universal machine. So this is what patients will progress to. And on the other side of the room, there are the treatment tables where they'll do more of the manual therapy, the hands-on soft tissue, the ultrasound, the skin.
Ultrasounds, yes.
Yeah, those kind of things to treat the acute injury. And then once they're feeling more stable, then this is where we teach them how to exercise. This is where we give them the confidence to get back into functionality and give them tools to go on and to continue these things on their own.
It's beautiful. So we've come full circle back to the front here, Doctor, and I appreciate your time so much. I know that Linda's going to show me the rest of the facility now, and I thank you so much for being with us today.
No, thank you for having me. Thank you for coming over and actually viewing our facility, and we look forward to serving the community and working with you again. Thank you.
Sounds great. So Linda, tell me, this is the obstetric and gynecology area. What else is behind the scenes here?
So I want you to picture that when you walk in here, it's like 3 separate facilities in one. The urgent care leases space from the hospital. Then we have a full-time physical therapy office that they even have someone that specializes in lymphedema, as we talked about, and they're even open on Saturdays. The urgent care is open 8 to 8, Monday through Friday, and then on the weekends shorter hours, but they're open every day.
7 days, wow.
And then behind us is our Bay OB practice. So there's 4 physicians that practice here, 2 females, 2 males. You know, women today like to have an option.
Absolutely.
And so it's like as if it was a practice anywhere else, but it has the convenience of being in this facility. So back there you have your regular gynecology visit, there's 2 doctor's offices, there are exam rooms, they draw blood, they do anything that a regular doctor's office would do, and they're affiliated with the hospital.
Okay. And is the lab service right here on location, or
yes,
do they send that out?
Yes, for that patient. So like even with the x-rays, if you need an x-ray, you can't just come here with an x-ray script. We're not a licensed standalone facility, but if you see an urgent care physician and they suspect you have something, they can take an x-ray for you, and then they have professionals that view it.
Oh, okay.
So just like the lab for the GYN, if you come to see your physician here, they make it convenient and have the facilities right here that they can draw blood, and they take care of it right here.
Excellent. So pretty much one-stop shopping.
Yeah, for many things. And you know, we're trying to see what else belongs here. Maybe we need an orthopedist. Maybe we need, you know, a plastic surgeon, something. So we're always up for change and see what else we need to do to service the needs of the customer.
Looks like there's plenty of space, a lot of room to grow.
Yep, absolutely.
And I guess you just want to see what the needs of the community are and then be able to facilitate to them.
Yes, that's it. Perfect. Says it in a nutshell.
Excellent. I am here with Linda Mazza, a very good friend and also a wellness committee member here in Woodbridge. And Linda is a vibrant part of this facility, so I'd love to hear what you think about why we're here and what this beautiful place can do for Woodbridge.
Well, you know, a few years ago, the mayor of Woodbridge and our president, Mike Dagnes, took a tour of Woodbridge because we wanted to have some medical facility in Woodbridge. Since Woodbridge really doesn't have a hospital, we would like to be that hospital, Raritan Bay. So they found this site. It used to be Domain Furniture, and we decided to put like a multi-specialty services here together. So now we just saw the OB/GYN facility. So it's like 3 offices under one roof. So we have some specialists that, like Dr. Bilar that you just met. We have pain management that are here on a routine basis, and we do have a cardiologist. And so we're trying to see what else Woodbridge would need so that we can make it a fast stop. So there's a new urgent care that just started in November, XL Urgent Care, and have gotten good reviews. And so people are used to coming here for quick things. So in that, we need to make sure we provide the quick service. So if you come here for an urgent care, you shouldn't wait weeks to go for a follow-up specialist. So that's what we're trying to pay attention to.
It's excellent. I mean, the location is extremely accessible. It's right here.
Yeah, everybody knows Jose Tejas. All you have to do is say right next to Jose Tejas, and then yes.
Sure. Well, it's a beautiful facility. It's maintained beautifully. It's impeccably clean and brand new. And it just has so many great things all under one roof.
And that's what we found, and we try to listen to the customer and make the changes appropriate. So like physical therapy here, there was a lot of lymphedema patients that couldn't find services. You know, once you've had breast cancer, a lot of patients need some lymphedema by a specialized physical therapist trained in lymphedema. So a few years ago we sent one of our specialists to that training, and she's really been able to serve that community. So I think it's good to listen to what you need to do and not, you know, put our thoughts on the community. And so Woodbridge has really embraced us. I think through the Wellness Committee we tried to do many things here, which is a nice location, whether it's free blood pressures or information on a regular basis about how to be healthier. Sure. And I want to just add something about, so I was a patient of Dr. Bilar's, and I did just what you talked about I had fallen, I went for physical therapy, and I was going on a trip. And I wanted to make sure that I was all good to do all this walking across Italy with my Fitbit on. So I came to him, and he made me feel much better that there was nothing wrong with me. I was healing well. So I think that I really believe in prevention and making sure we listen to our bodies. And so I'd like us to think that we have all of that for the customer.
I think healthcare is definitely heading in a different direction, and I think that, you know, most people are embracing that preventative medicine, integrative medicine, and it looks like this facility has, you know, a lot of that to offer. I think urgent care also, I know that even my own primary physician doesn't see us for acute anymore. So you need a place to go when you're just not feeling well. And then just to be able to offer the physical therapy and everything right here with the sports medicine is great. And the awareness of knowing that sports medicine isn't just for athletes, I think is a very important thing that we need to get out there, that it's for everybody.
And I think that this urgent care doesn't see people that should still be following up with their physicians. So, because some of our physicians actually use them when they're, you know, if you have just a sore throat and they have their chronic patients that they're seeing on a regular basis, they have a relationship with this urgent care to send them here to just, you know, if you call it 5 to 5 and you need a prescription and it's a Friday afternoon, well, they're open till 8 at night. So it really works for everyone on both sides.
It's bridging the gap. It's bridging the gap for working parents. You know, gone are the days where you just see your pediatrician at a certain time or you're calling them on late hours. I know as a little girl, I was delivered at Raritan Bay, and my doctor used to visit us at home and do house calls. That's really not happening much anymore. So the ability to go to a facility that's still open, you know, in the middle of the night or on late hours, sure is great.
And I think the Wellness Committee has helped us all be friends, even though we might be seen as competitors sometimes. Like the Kinder Pediatrics
Jillian is one of our wellness things, and she has embraced the urgent care that's here. They share patients because she's just pediatric after hours as well, and so it is really a nice bunch we have of friends.
Absolutely, absolutely. We've come a long way on the wellness committee. I think just trying to let Woodbridge be aware of what there is out there and what we can offer by way of healthcare. And you are definitely the liaison of all of that, tying everybody together and helping with all that networking. So I have to thank you for that. I know that you do so much for this community, and it's great to have
just
you.
a text away.
You are. You are.
Some of the things that I'd like to just make you aware of is now that we're part of Meridian, that will also, I think that's been a wonderful thing for us. So Raritan Bay is part of the Meridian health system, and in the future they plan to merge with Hackensack and be the largest system in New Jersey. But that will bring different resources to us as well. I've brought some of the Meridian counterparts to some of the things in Woodbridge, and they're excited to get to be part of this community and join Middlesex County.
Well, it's a very open-minded way of thinking, and to be able to offer services and bigger services and more resources can only be good for Woodbridge. So
yes, I agree.
Thank you so much for being here with us today.
My pleasure.
And thank you for taking us on this great tour, and we're so excited to see this facility here. I think it's going to be a great benefit to the community.
Yeah.
So thank you for joining us today on Wellness Woodbridge. We hope that you've enjoyed our time together today and that you've learned some things about getting moving and staying healthy and what Woodbridge has to offer in these beautiful facilities that are, very accessible to you. So thank you so much, and I look forward to seeing you again on Wellness Woodbridge.